Hello, everyone. Welcome to episode 11 of LAMP Auricular Medicine course. Today, we discuss the clinical energetics of the points of antihelix and the points on the posterior aspect. These are the points of the antihelix. Let's start with the toe point. Number 76 is toe point. As you can see, it's very good for diverse toe problems, fractures, bunions, hammer toes, arthritis. Point 77 is the heel point for heel problems, calcaneal spurs, heel pain. Point 78 is the ankle point, good for ankle problems like break, sprains, swelling. Point 79 is the knee point. This is the key point for knee crepitation, achiness, weakness, cold knees, disorders involving knee ligaments or knee joint, or for circulation problems around the knee. Point 80 is the lumbago point. Excellent, highly clinical effective point for low back pain in the lumbar region. This was knee point in earlier literature. Now the knee area is above the lumbago point. Point 81 is the sciatic nerve point. Quick acting, clinically effective, treats symptoms of compressed sciatic nerve and radiating pain down back of the leg. Point 82 is the ischium point for problems originating from the buttocks, sciatica, or problems pertaining to the ischium, lower portion of the hip bone. Point 83, buttocks point for ischium or other gluteal problems like torn muscles, local point for sciatica. Point 84 is the abdomen point for general diffuse specific abdominal problems. This can be used alone or for reinforcement in combination with large intestine point or appendix point. Point 85 is the chest point for chest tightness, shortness of breath, asthma, cough, cold, used singularly or in combination with mammary points, lungs, and heart. Points 86 to 87 are the mammary points for fibrocystic breast disease, breast distension, tenderness. Point 88 is the neck point. Fast working point for treating stiff neck, torticollis, cervical disease, misaligned vertebrae. Point 89, throat and teeth. For tonsillitis, sore throat, constriction in the throat, problems in general, or tooth problems in general. Points 90 to 93, sacral, lumbar, thoracic, cervical vertebrae. Effective for adjusting the vertebrae in associated portion of the spinal cord. Treats the nerves originating from corresponding portions of the spinal cord that innervate organs and dermatomal areas. Now let's go to the points on the posterior aspect of the ear. Point 94 is the vagus point. This is a strong point to regulate functions and organs of the middle jaw, which vagus nerve largely supplies. This is good for gastralgia, helps expel gallstones. The vagus nerve is good for headaches, asthma, stomach ache, palpitations, bowel problems, areas that the vagus nerve, the longest cranial nerve in the body, innervates. This is where the vagus nerve enters the ear to innervate it. From there, it goes to the lung points. Points 95 to 97 with the upper, middle, lower back correspond to back problems. For added reinforcement, use these points with corresponding back points on the front of the ear. For example, use the upper back on the back of the ear with the upper thoracic vertebrae on its anterior surface. The 98 is the lower blood pressure groove. This is a powerful groove used to lower high blood pressure, especially when the groove is bled. Point 99, superior root of the ear. It treats hemiplegia. Point 100 is the spinal cord point for muscular atrophy and paralysis. Thank you very much for your attention.